Basically, in summary, COVID at home is when we come together as a medical team, but not just medical team, medical supplies, meals, emergency standby, nurse visits, caregivers, all stand by together to support a person throughout the period of this COVID quarantine session. We provide a variety of different services like doctors monitoring, teleconsultation, nurse visits. We can provide swab tests at home as well. We can stand by ambulance for this person, send meals to this person,
Besides what Dr. Lim has mentioned, sir, the most important, I think he has been highlighting to us is the telecommunications with the doctors and also the video call by the nurses if you have any problem. That the most important thing is that we don't wait for you to reach out to us, but we reach out to you daily. That is the main thing of the package, and also any essential needs. For example, we provide also some of the simple medical equipment, for example, pulse oximeter, thermometer, and also some of you might require a blood pressure monitor devices, because sometimes the moment you are diagnosed or you have your swab done, you won't be able to get all this stuff. And some of the supplies on like multivitamins and medications as well. If throughout the 14 days you are required to quarantine at home, we're able to provide the swab test as well. On the 13 days or 14 days, we come to your house to do a swab test. Before you get the release. And we also will give consultations and guidance for you the moment you diagnose what should you do.
So as we know, COVID, they're differentiated into 5 categories. Category 1 are people that are diagnosed positive and are asymptomatic, means they don't have symptoms. But some people, they are asymptomatic at first, but maybe after a few days, they may develop symptoms. So when the person develops symptoms, they fall into category 2. All right, category 2, any symptoms, fever, coughing, running nose, general discomfort, loss of taste, loss of smell, some people even diarrhea. So COVID symptoms are not very specific. So anyone that has symptoms and tested positive for COVID, they are under category 2. People in category 1 and 2, generally, they can be monitored at home. Category 1, category 2, they are generally quite stable. Category 3, if they don't have breathing difficulties, right, generally they can also be monitored at home, all right? But if once they develop breathing difficulty, then going to the hospital is definitely the right choice.
Actually, it's not whether we are qualified or not, we are already doing it actually. So when last Tuesday, when Miss Yeo was saying, give this idea, I thought, hey, we've been doing this, why don't we expand it further? In fact, since COVID started, on the average, every day I receive 1 or 2 calls from friends asking what to do, how to handle medical issues, where to get medical supplies, whom can I contact to do whatever services needed. As we have I've been doing this for a long time myself, why not we just extend a little bit more, that's all.
What makes us qualify is, I think we are medical professionals, number 1. We are aged care professionals. Manto has been in the aged care line for forever. Miss Yeo is a nurse, I'm a doctor. So what better, combination to put together to come out with this kind of monitoring services, COVID monitoring services at home. So I think we definitely are very qualified to do this. And it also is part of the national service that we want to give to the Malaysians as well.
When I started to have this idea, it is a pure initiative from me that, hearing from the public, hearing from a lot that there are so many grievances from those who have diagnosed with COVID or those who are waiting for the result to be released, when after they have tested with COVID. They feel very helpless because the moment you are going through the test, you have to be quarantined. And what's more that you've been diagnosed with the COVID, you're going to be at home for 14 days. So during these 14 days, the moment they have their swab done, sir. So what will happen is that they find it like they're unable to reach out to their essentials. They are clueless. They do not know what to do. At the same time, they are worried. They are worried as well. Their conditions, what am I going to? Am I going downhill or am I getting better? Where should I be checking to a facilities or hospitals to seek help? So sometimes we know that government has been working very hard to reach out to all the people and timely and all this. But the thing is, because of the number has been increasing tremendously, they won't be able, there are challenges faced by this group of COVID diagnosed patients that are unable to reach out to the government on time. So there's a reason why I was thinking like, if we Jasper can come up something, to help these people, to reach out to them, in order waiting for them to reach out to an authority, why not we reach out to them? We help them, we support them throughout this crucial, essential period of time, to support them throughout their healing period, and also to give them a bit of reassurance and also assessment on their day-to-day symptoms and all this.
We are running out of ICU beds, we are running out of ventilators, we are running out of resources in the hospitals. So this is one of the reasons why we want to help decongest the healthcare service providers in the country as well.
I think the most important is at this time, okay, when you are having COVID, the moment we have COVID, one of the things that goes into our mind is that we are going to die, or maybe we are going to die. So, and it's going to be very lonely, and because nobody can get near you. So what we want to assure you is actually 99% of people survive. And the other thing is this: we want to walk with you through these 14 days as your friend, as your extended family. If you have parents who need help, we will become your brothers and extended brothers with knowledge to walk your parents, cover your parents for the 14 days to keep them have a peace of mind and give you a peace of mind. And if you are an elderly person, if you do not know where you are going, how to get things done, we do have people in the call center to assist and guide you through in your day-to-day. You don't have to walk alone.